right, welcome to the Dr. Lexi Show. Today I have a very special guest that everybody knows about anyway. Marybeth Tomory, like amore.
There you go. You got it. As an MFM sonographer, I've never seen a live ectopic. Let's put that out there.
Okay.
In my 25 years, I've never had a live ectopic, which I think is stupid. Like, how have I missed it? I don't know. Maybe early in my career. I don't know. I've seen ectopics, lots of ectopics. Never a live ectopic.
Okay, but
I've seen 4 trap cases.
Okay.
So it's funny like that.
And I think people...
It's important to recognize that I just don't know what it is. And it's okay to say, I don't know what this is. It's so...
So because you said that too on ectopics, one of the only cornual ectopics that made it to a live baby, I delivered.
No way.
And wrote a paper about it.
That's awesome.
And the MRI... And this is going to go into totally...
I bet
MRI,
I bet
it's like you see this baby and the beautiful spine and whatever, and then you see this tiny uterus. The mom's uterus is down here, and then there's a fetus all above it. And it's like, okay.
Something here is not right.
Something is not right. That he just turned 13 maybe recently, which makes me feel very old.
Yeah.
But it was fascinating because we didn't know whether it was in a cornual part or abdominally implanted.
Sure.
But presented to us at like 28 weeks. And we're like, that's definitely not in a uterus.
Yeah. We can tell it's not in the main body, in the corpus of the uterus.
Concerning, we went in with a camera before the baby was delivered to see where it was.
Yeah.
And all you see is like this thin white sheath. And then you can almost see like amniotic fluid underneath and baby. And it's like, okay, it's clearly not myometrium or the thick part of the uterus around the baby. But we still couldn't tell where it was coming from. So by the time there was delivery, kid you not, we go in like you would for a normal C-section. Because you couldn't deliver vaginally. Sure. Because it's not in the uterus. It's not connected to a cervix.
I gathered that part.
Okay.
Mm-hmm. I'm no physician. I'm no surgeon like y'all are, but.
So going through the skin, open up the abdomen, and you're looking, and you see this clear, almost clearish, whitish.
Yeah.
And you just make a little incision, and then the amniotic fluid comes out, and then that whitish thing that was surrounding the baby just goes, and like disappeared. And I was like, oh my gosh.
Okay.
So once the baby's out, it's like, okay, well, where was this? And you see this tiny uterus that's still a normal, non-pregnant uterus and a little outpouching of this little sac.
Was it like the subserosal layer of the, like, did it bubble out
It bubbled out a little bit. So
layer.
then we basically cross-clamped and got rid of that cornual area. It just was like this oversewing, and it's like, and that's it.
I think I'm good
Fascinating.
here.
Fascinating.
Fascinating is the correct term.
Yes. Okay, so
side note.
I want to side note. Tangential. I think I titled one of our things before tangential topics with an ultrasonographer because that is what we do.
Yes, we just talk in stories.
We do. Tell me really quick to the hashtag or your thing on Instagram and all that jazz.
I am Sonoeyes Ultrasound on Instagram. I mean, I'm technically on TikTok.
Is it the same thing?
I think it's sono.eyes. That's what I'm on TikTok. And of course, I'm on LinkedIn.
Yes.
Things like that. So
all the things.
Yes, all the things. Facebook too. But really my Instagram is where the majority of my content lies.
Thank you very much to Marybeth Tomory for all of her help and guidance.
Thank you for having me.
Everything ultrasound related, which is fantastic. And we'll have you back again as long as you'll come back.
Anytime.
We'll make it a regular stop here. But we hope to have expanded your knowledge, developed some skills. And as always, we want to have an impact on you and your pregnancy. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.